Hi everyone, my name is Natalie,
And I'm Caitlin.
and I'm going to share my screen really quick so you guys can see our capstone project.
So our capstone is titled Beyond the Blues, where we will be talking about educating nurses about postpartum depression on an acute hospital setting. So just a little background, although postpartum depression is a known disorder, it is estimated that 50% of women who suffer from postpartum depression disorder go undiagnosed. The Edinburgh Postnatal Depression Scale, also known as the EPDS, was developed over 30 years ago to be a self-reporting tool for the identification of postpartum depression symptoms throughout pregnancy and the postpartum period. It was found that postpartum nurses are not educated on how to implement the tool and educate mothers and their support system on the signs and symptoms of postpartum depression disorder in the home setting. The education tool was developed to increase nurses' ability to implement the EPDS and detect early signs and symptoms of postpartum depression while in a hospital setting. To explore the outcome of educating postpartum nurses on the implementation of the Edinburgh Postnatal Depression Scale, we devised a PICO question stating, on a postpartum unit, will the education of the Edinburgh Postnatal Depression Scale increase the nurse's ability to recognize the early signs and symptoms of postpartum depression disorder? To answer our PICO question, we used a pre-test, post-test design. We gave a pre-test to the nurses on a postpartum unit to get a baseline of their knowledge on postpartum depression and the Edinburgh Postnatal Depression Scale. We then educated them on postpartum depression in the use of the EPDS and early identification of postpartum depressive symptoms. To evaluate the effectiveness of the education, we then gave the nurses a post-test to fill out that consisted of the same questions as the pre-test. We also provided physical copies of the scale itself and the scoring sheet that goes with it in order for the nurses to feel comfortable evaluating and interpreting the results to plan the best care for their postpartum patients.
We tested 20 postpartum nurses from the family birthing unit at Fort Hamilton Hospital. This included a pre-test and post-test that consisted of the same 3 multiple choice questions and 2 select all that apply questions. These questions are, what is the purpose of using the Edinburgh Postnatal Depression Scale for postpartum patients? When should the scale first be implemented? What are some early signs of the postpartum depression disorder? What is your role as the nurse regarding the use of the Edinburgh Postnatal Depression Scale? And why is it important to educate the support system of the mother on the signs and symptoms of postpartum depression disorder? As you can see, results from the pre and post test showed a 10% increase in average score after the education was received. Overall, the education of the Edinburgh Postnatal Depression Scale was effective as shown by the results. The nurses on the unit reported a better understanding of the screening tool and how to identify at-risk patients. These nurses feel more confident in their ability to provide education regarding postpartum depression. And then here are all of our references. Thank you guys for watching our capstone project. We really appreciate your time.